Hello, welcome to Media Roast. Today, I'm going to talk about something that the media doesn't want to talk about, neither does the government. It just shows their lack of ability to see what's in front of them. Today, I'm going to talk about healthcare. Now, in the past, I have lived in foreign countries with socialized medicine. And the key thing that makes socialized medicine in these countries work, okay, is the fact that the education to become a medical person, depending on whatever, is borderline free. Now, in America, you can never do that because, first off, the banks would lose significant amounts of money in loans, right? Which is backed up by the government. Okay. Second reason is if you were to implement a program where students could go to medical school or dental school or nursing, whatever, for free, you still have millions of people that have student debt. So it would be completely unfair, and you're going to isolate these people, and they're going to vote against you getting this system. Now, so in the United States, it's borderline impossible to really achieve this unless someone spends a lot of money. Now, with the current deficit like it is, this is severely affecting things, cost and stress and more. Now, they say that COVID overworked a lot of medical people. I could kind of see that. I'm not doubting it. I think worldwide COVID overworked a lot of medical people, and then some left. But if you go to the EMSI data, they found that there will be a critical shortage of 3.2 million healthcare workers by 2026, right? Like if you go on to the Kaiser Family Foundation, right? They found that 3 in 10 healthcare workers consider leaving the profession, and about 6 in 10 said it was related to pandemic stress, right? If you go on to which healthcare workers, right? And this is at ncbi.nlm.nih.gov, right? In the pre-period and the post-period, the lowest turnover rates were among white healthcare workers is pre-period. 2, the lowest rates were among healthcare workers reportedly being of. I'm going to tap on that. Let me go back this. It said the observational cross-sectional study among 125,717 healthcare workers found long-term care workers and physicians saw an upward trend in turnover rates. Healthcare workers employed as health aides and assistants, those of historically marginalized racial and ethnic groups, and those with young children, particularly women, had persistently high turnover rates and were experiencing a slow recovery. Meanwhile, meaning these findings suggest that the turnover rates are returning to pre-pandemic levels across most groups of healthcare workers, yet the recovery is uneven. Targeted solutions are needed to ensure an adequate healthcare workforce is available to meet the patient demand. Now, that's the National Library of Medicine, NIH. Now, when we look at this, right, I will say I work in an aspect of the medical industry, so I have some experience with this. Nurses are sometimes working 4, 5, 6 days straight, 12-hour shifts, sometimes longer, right? And they do get burned out. But how do we fix this? So we can't just give schools away, right? And we can't turn around and tell people who have loans to be in the medical industry that they have to pay them back, and other people going to school are going to school for free. So, how do we fix this problem? Either A, we take college costs and we peg them to the current value of the dollar, along with inflation and other stuff, where you can tag the cost of college, so they can't keep raising the rates past a certain amount, and then they might have to actually fire their 200 man or 200 woman DEI group, right? It's just a cocky comment. But driving down the cost based off the degree, the type, the class, and everything. I'll give you an example. When I attended college in, I want to say 2011, get my other degree. I went for a degree in accounting. Do you know how much a used accounting book cost me in a primarily 2-year degree at college? $400 for a book. Okay, now this was an accounting book. All right, and the only difference between this book and the new book was a couple pages they changed so they could sell it and make more money. Now, this is a perfect example of the money-making machine colleges are there. So we can't generally go in there unless the Congress goes in there and the Department of Education goes in and makes major changes to this, right? But then you're going to have to get some accountants and some eggheads in there to figure this out, right? And it may drive down the cost of college. Now, on the other hand, an immediate turnover is going to be, and the world doesn't want to hear this, but is giving visas to skilled workers, not unskilled workers coming across the border. Skilled workers that are proficient in English, right? As nurses and doctors and pediatricians and whatever we need, right? Give them the visa to come work here and then stay. Now, the difference between the migrants we have now is the 99% of those we have now are uneducated and cannot speak English. Therefore, before they could even consider going to school to get a skill, they have to first learn the language. Last time I checked, medical books were not all in Spanish in America. This is going to be a problem. Or they weren't in Chinese, or they're not in Russian, or anything else, right? So now, we come to the visas. The United States government could target countries, right, where they have English as a primary language, they have the medical schooling behind it, or the experience, and then they could come to the U.S. on that visa, and the hospital could gauge them, and they could work in an underling position with a supervisor that knows what's going on until they're certified 100% by the hospital to do what they're doing. I would say the Philippines. I would say India. I would say parts of Europe and other places to set up. Australia. Australia doesn't. They don't need no. Of course, they don't need their healthcare workers down there. And United Kingdom and other places. And I would just say that if the Ireland, Scotland, if we targeted these areas, we definitely could get the majority of our positions filled in the healthcare region. So this is definitely a plus. Now, it would take the government pulling their heads out of their rectal cavity to do this. But it is a very quick, easy fix. You get more people in the country, and at the same time, you're going to get educated people in the country, not uneducated people that suck off the system. So it's just a concept. If you're in the medical field or you're from one of these countries and you think that it would work, leave a note, subscribe, and let me know what you think, and maybe I can do another video on this. Have a good day.